All right, so we have comparative x-rays for a patient from 6.5 years ago when we saw the patient back in March of 2018, where the x-ray was taken from the lower back. Here's a lateral x-ray. You can close up on 5, 4, 3, 2, 1. And today, patient's experiencing pain within the side of the leg, side of the thigh, and also pain in the lower back around the left SI joint. So if you notice here, we have L2 that seems to be positioned correctly. But now 5, 4, 3, 2, you can see that L2 is now posterior. And we also see the osteophytes in front of that vertebrae. We can see that end plate whitening, and also you can see that top of that vertebrae is a little bit sharper and starting to cave in. So we know we have poor mobility in this segment. L3 disc is also degenerating right there, and you can see in comparison to past that L3 disc was fine. So we'll be working on this segment, taking the pressure off L2, L3 nerve, and I think that's going to significantly improve the pain on that left lateral thigh, as well as the left SI. I'll be scoping the lumbar spine as well as the rest of the spine to see where the pressure is at. We're going to go down to that L2 area. Getting a little reading there at L2, right there. Let's go down to L5. That pressure comes back to neutral, and it remains all the way. So the pressure is there from L2 all the way down to L5. And let's just use another scope just to compare that. Right there. Right there. L2. All right, so we're going to adjust that L2 on the Gonstedt Nietzsche stable. Stop. Estómago, por favor. Citrono. Okay, you did good. Go ahead and come up. The last time we saw him was over 6 years ago.
Yes.
And he had the shoulder pain, right?
Yes.
Yeah.
Stiffness and pain.
Yeah, and how long did that take for it to go away?
2 adjustments.
2 adjustments,
Yeah,
okay.
2 adjustments, and a couple weeks, he was back to normal.
Okay.
So he did really well, responded really well to the treatment.
Good.
And with faith
Yeah.
and you being
Oh,
so
yes.
good,
Yes.
he responded really well. And overall, he's a pretty healthy guy.
Yes.
Keeps active, so.
Yeah, and you guys know, the goal is not to prolong the treatment. If we can fix the patient with 1 adjustment or 1 visit, that should be our goal. Having treatment plans, not knowing how long it's going to take to heal someone is wrong. We should do what the patient needs,
Yes.
not what we need. And I think with today's adjustment, we did some new x-rays because the old ones were about 6 years old.
Yes.
I think he's going to be just fine with today's adjustment. And if he continues to have this symptom, then he can call me again.
Okay.
We'll check, but we're not going to know. but my guess is that I think today we got it.
Yeah, good. I'm happy because
And-
he's a pretty happy guy. Usually,
Oh,
usually,
yeah.
but when he's not used to pain,
Yeah.
so we're glad we brought him in pretty quickly.
Yeah, no, I told him he's got good energy, and
Uh-huh.
we
Yeah.
got to respect our patients just like they're one of us.
Yes.
So
Thank you. Yeah, you've been
Thank
really
you.
good to
Yeah.
me and my family and everything. So
we have to be.
yeah.
You know.
Thank you.